Hello again, everyone. My name is Marty Guthmiller. I'm CEO of Orange City Area Health System, bringing you today the 93rd edition of our COVID-19 community briefing. Before we begin today, I've had a few people that tell me they're going to listen up to 100 and then call it quits. And so, okay, well, we'll see if we hit 100 at this point, but today is our 93rd edition. We're going to jump right into the local scoreboard. As has been our practice. So far, we've had 1,807 positives of the 9,282. So as a collective percentage, just more for your information than of practical use, is 19.46%. So just under 20% historically. That's, again, since the beginning. For the last week, we had 14 positives of the 200 tests that we performed here at Orange City Area Health System. That's a 7% rate. Last week was 10%, and the 2 weeks prior to that were 7% each. So a relatively low rate in terms of our positivity, and it is causing the overall rate since inception to go down, but slowly. Jumping to Sioux County to look at a couple of the statistics that we've had a history of looking at, our 14-day average, and all the numbers again are down throughout this entire report. So that's good. They're kind of stabilizing in a way, but stabilizing in a low end. So again, positive result. The 14-day average in Sioux County is 6.5%. That is down from 6.9. 8.2 and 10.1 3 weeks ago. So 6.5% 14-day average. The 7-day average is 5.4%. Last week was 5.2. So we had a 0.2 uptick actually. Statistically not significant. Down from 2 weeks ago at 5.3. and down from 3 weeks ago at 7.2. So 7.2, 5.3, 5.2, and today 5.4. Our positive per 100,000 population over the last 7 days is 80.2. That number is down 75% from the previous 7-day period of time. And again, that 80.2 doesn't mean a lot unless you look at it in context of others. And when you look at the total state of Iowa, the per 100,000 population 7-day indicator is 130.7. And that's been pretty steady, but it's down 0.6% from a 7-day period previously. So Sioux County is 50 people less per 100,000 than the state average. So a good number in Sioux County. We did have 31 new positives in Sioux County for the week. The number in Sioux County is now 4,695 out of the 14,568 individuals tested. But again, 31 new positives in Sioux County. So it's still out there. In terms of Region 3, the 20 counties in Northwest Iowa, there are 16 hospitalized in that 20 county area. That is down quite a bit from where we were in the past. A week ago, we were at 29. 2 weeks ago, we were at 32. And 3 weeks ago, we were at 50. And so 16 is a pretty good number relative to the status of the pandemic. There are 7 patients in the ICU in Region 3 as well. That number was 9 last week. We have 3 patients on ventilators. That number last week was 6. And so some improvement overall. Again, I do not know the disposition of those patients, of the 9 that went to 7 or the 6 vents that went to 3. I don't know the disposition of that. But as we look at it today, that is a positive situation. In the Iowa, from a state average perspective, 14-day average 7.9%. Again, that's a comparable number to Sioux County at 6.5. So 7.9 today. A week ago, 8.8. 2 weeks ago, 9.9. And 3 weeks ago, 11.0. So we've had a steady decline in the 14-day average. On the 7-day average, Iowa's at 6.1, again, compared to Sioux County at 5.4. 6.1 compares to a week ago of 6.6, 2 weeks ago at 7.5, and 3 weeks ago at 8.5. So again, a steady decline in the 7-day average. I did mention earlier that our positive individuals per 100,000 population over the last 7 days was 130 at the state level. In terms of Iowans being hospitalized somewhere, whether it's in-state or out of state, in our case, South Dakota, most likely, if not here, the number of hospitalized Iowa residents is at 240. That's the first time in the 200s for since I can remember, and not just barely in the 200s, but at 240. So again, very strong numbers in terms of Iowa as a state. A somber reminder that this is truly not over. We did have more deaths again this week, 128 according to the statistics at 5,236. Sioux County official number is 67. Again, a reminder of the demographics. 93% of those deaths were in the 60 and over category, age 60 and over. 98% of those deaths is in the 50 years and older age bracket. So 98% 50 and up. The rolling 14-day average in the deaths is probably the lowest when you go back to early April of nearly a year ago, basically the beginning of the pandemic. Our rolling average is the best that it's been basically since the beginning. So very strong indicators there. I want to talk now a little bit about a couple of things going on, maybe a couple things that you're wondering about. Mask wearing is getting some attention again. And just a couple reminders regarding masks. Continue to wear them. When you're not able to socially distance and when you're out and about, please continue to wear your masks. It's important to keep your mask clean. It's not a badge of honor to have worn your mask for a month or 2 or 3. Keep your masks clean, either by washing them or if they're disposable, get rid of them and get a clean mask. It's important to keep that clean. Keep the mask tight against your face also. It doesn't do good to have it below your nose. Doesn't do good to have, baggy on the sides where droplets can get out. And so keep it tight against your face. Honor those businesses that choose to maintain the policy that Governor Reynolds loosened up, healthcare facilities being one of those entities. We are actually mandated to put into place measures that protect the public, and we believe that continued masking here on our campus and within our facilities is appropriate, and we ask that you honor that. Again, generally, regarding mask wearing, the same thing we've been talking about for months. Apply some grace, understand grace, use grace. It's really important that we continue to honor folks and use common sense in those environments. So that's it on masking. As we begin to embrace better numbers, embrace at minimum a lull in this pandemic, if not beginning the end of this pandemic, is how do we loosen things up, so to speak. One of the things that it's important for you to know is that we are having those discussions at the hospital per se and clinic One of the things that we're doing now is allowing 2 visitors throughout. So whether that's you know, in a clinic room or in a hospital room visiting patients, we are allowing 2 visitors. We're not doing pre-op testing anymore for the nasal swabs, unless some questions are answered in a certain way or there are other indicators. The pre-op testing is no longer required. We are still not allowing patients with COVID to receive visitors. We believe that there's still an obligation to mitigate the spreading of that disease. And so we still will not allow that. But we have a number of technological things that we can do to help minimize the inconvenience with that. And we'll continue to watch this and implement changes as we feel comfortable moving forward. In terms of senior care, very good news in senior care in terms of 95% plus. It's higher than that, but you know, it's above 95% of folks that have received their booster vaccination now, so have received both sets of vaccine. And we're even better yet, most of those folks are in the 2 weeks post second dose, which means that the full efficacy of the Moderna vaccine, Pfizer vaccine in the nursing home case is in place. And we feel very good about where we are in both our nursing home and in Landsmere Ridge. The same situation is there. 2 different scenarios in Landsmere Ridge. The assisted living was taken care of through the Walgreens process. That is complete. And the independent side was taken care of through our Moderna process. And those folks have received their second dose as well. So what we're doing in senior care basically is awaiting guidance from our regulatory bodies as to now what. What can we do now that our people are protected? How can we open things up? We're beginning to do that a little bit more, but again, we are constrained by Department of Inspection and Appeals, CMS, all of our regulatory bodies in terms of have they caught up to speed yet with the position that we are, and what do they say we can do at this point? So we're anxious to get going. We still think March 1 is a really good date in terms of everybody being as bulletproof as possible out there from with respect to the disease and the virus. And that's where we are in senior care. Give a little bit of update now on the vaccine and where we are currently with that. Overall, we've given over 1,500 doses to date. So since beginning late December, we've given 1,500 doses. About 1,150 of those doses are primary doses, and we've given about 350 booster doses. And these 1,500 vaccinations are in addition to the nursing home. That doesn't count the activity in the nursing home. Relative to more recently, in beginning February 1st, we've given over 600 primary doses to the 65 and over age group. After this week, that number will be over 800 doses as we have folks scheduled again on Wednesday and Thursday of this week. So after this week, we'll have given over 800 doses to the 65 plus age group. We do have about 600 on our waiting list beyond this week's appointments. So it gives you an idea on where we're at. So again, 800 after this week given, 600 on the wait list. That gets us about halfway through our database of about 3,000 patients. Although remember, in that database includes nursing home residents and things like that. So we're well over halfway through the 65 and older group. and we wanted to be able to communicate that to you at this time. Continue to call in. If you're particularly in the 65 plus group, we're taking waitlist items for that, or names for that. And so continue to call in. We will build appointments based on our allotment from that waiting list. Currently, our expected allotment is only 170 a week. From this point forward, we're expecting a little over 200 this week that we're going to do. From this point forward, we expect 170. And so that's going to be frustrating for us, frustrating for you, but it also gives you an idea, if we're doing 170 a week, how quick we're going to get through that 600 waiting list. So it's going to be all of March, most likely, unless the allotment is increased. Again, frustrating. It is not. It's not that we aren't able to get the shots in the arms. It is the fact that we can't get the vaccine, and so that is that's a point that I think you need to be very clear about. In fact, as a county, last week we gave over 90% of our allotment from the state into people's arms. So that is a requirement. If you only give 80% or you give less than 80%, you're not going to get any more. It's going to go to somebody else. And so as a Sioux County as a whole, it's important for you to understand we're getting the vaccine out into folks at a rate last week that exceeded 90%. So that's a very good thing. Stay tuned. We are hoping for a day when 1,000 doses drop into our lab. We're not expecting that. But again, we're committed to, if that would ever happen, you're going to see us in very short order having some mass clinic capabilities and getting that done. But we got to have the doses before we can do that. The last thing that I want to talk about today is just a reminder that our Test Iowa clinic is still open 5 days a week. There's no charge for that. And so if you're concerned or you need to be tested for COVID, that is an option for you 5 days a week. It's a walk-in situation into our MB1 facility, occupational health area, 5 days a week from 8 a.m. to 9 a.m. And like I said, you can either walk in or you can call ahead 737-5273. So 5273, or simply walk in MB1, located on the west end of our main campus. That's going to do it for today. Thank you again for joining us. Thank you for the trust and confidence placed in us. If you're one of our patients, we appreciate that greatly and will not take that for granted. That's it. Stay strong, stay vigilant, and stay healthy. And we'll look forward to a briefing again if you're interested next week, Monday. Thanks again.